Assalamu alaikum. My name is Dr. Samina Sohail, and I'm a family physician. I have been practicing in the Cincinnati area for the past 20 years, and I was asked to give a little talk about breast cancer awareness. October was Breast Cancer Awareness Month, but this is really something we should be thinking about year-round. So with that, I'd like to begin telling you a little bit about what breast cancer is and why it's important to give it its due attention. So breast cancer is basically a group of diseases in which cells in the breast tissue change and divide uncontrolled, typically resulting in a lump or a mass. Excluding skin cancer, breast cancer is the most common, frequently diagnosed cancer amongst women. 1 in 8 women, which is about 13% of our population, will be diagnosed with invasive breast cancer in their lifetime. 1 in 39, or 3%, will die from breast cancer. However, it's encouraging that with early detection and treatment, these statistics have been improving, and the current 5-year survival rate is at 90%. Breast cancer is not just one disease, it's a whole constellation of diseases that affect the breast, and they can be classified by stage, the presentation, the histological type, the receptor status, and it's really important because that guides treatment and outcomes. So a lot of people ask, what are some signs and symptoms of breast cancer? And really, the most common sign is that there are no signs. It is usually a silent disease in the beginning, and that is why, as I'll talk about later, screening is so important. If there are some symptoms, the most common ones are a painless lump or an underarm lump or swelling. And since women have access to their breasts year-round, it is recommended just to get to know the nature of your breasts so that if abnormalities arise, you're the first to notice them and seek attention. Less common signs include breast pain, heaviness, swelling, thickening, redness of the skin, any changes in your nipple, spontaneous discharge, especially if it's bloody, scaliness, retraction, which means a puckering back, are all important things, and any question that ever arises should be evaluated by your physician. So, what are some risk factors that decrease and increase your breast cancer? So the things that decrease the risk for breast cancer actually are just mainly a healthy lifestyle, maintaining your weight, having regular exercise 3 to 4 hours a week, and a few other things that seem to decrease the risk is 1 or more full-term pregnancy, especially if that pregnancy is before the age of 25, breastfeeding, and menopause before the age of 50. The factors which increase the risk for breast cancer, conversely, are being overweight or obese, having a sedentary lifestyle, drinking alcohol, being exposed to radiation. Age, as we get older, we have a higher risk. And then early menstruation and late menopause, because the longer the estrogen is around, the higher the risk of breast cancer. Family history is important, and I'll get to that in a minute. Any genetic mutations, especially what's known as the BRCA genes, and hormone replacement, which women used to take a lot more commonly in the past to deal with menopause symptoms. It's not as much in favor now, but that is also a risk factor for breast cancer. So this is an important slide to keep in mind, especially the things that are in our control, like our weight and exercise and the lifestyles that we live. That being said, because breast cancer initially presents as a silent disease, screening is recommended. And this chart down here just shows that different organizations have different recommendations for the screening schedule. However, generally speaking, women without risk factors should be screened with mammograms. Most organizations say every year at the stage of 40. A few organizations say every other year, but I would suggest the best approach is to discuss it with your physician. Keeping in mind that there are certain women and men who should be screened earlier. These are people who have a first-degree relative, which includes a parent, a child, or a sibling that have had breast cancer, especially if it's at a young age, cancer in both breasts, or if the affected relative has been a male. And with that, I would like to thank ICGC for asking me to provide this health update. As always, if you have any questions, please discuss them with your doctor. Thanks.